Country in a state of uncertainty after President Trump contracts the coronavirus and ends up in the hospital. This hour, we're monitoring the health of the president after he, the First Lady, and top advisors test positive.
I came here, wasn't feeling so well. I feel much better now.
President Trump's physician says that the president continues to do well, but he is not out of the woods just yet.
Over the next period of a few days, I guess that's the real test, so we'll be seeing what happens over those next couple of days.
President Trump releasing a 4-minute video Saturday night from inside Walter Reed Medical Center, where he is fighting the same virus that has killed more than 200,000 Americans. When the president was admitted, the White House said it was done out of an abundance of caution. But we now know the mild symptoms that Chief of Staff Mark Meadows had said the president was experiencing were actually much more serious.
He's made unbelievable improvements from yesterday morning when I know a number of us, the doctor and I, were very concerned.
On Saturday morning, Meadows said the president had gone through a very concerning period and was still not on a clear path to recovery. But mere minutes earlier and just steps away, the president's physician gave a brighter assessment.
The team and I are extremely happy with the progress the president has made.
It's still unclear exactly when or where the president contracted the virus, but the White House medical unit is looking at last Saturday's Rose Garden ceremony for Judge Amy Coney Barrett.
With the president in the hospital, there's a concern about the continuity of government. Is the campaign giving any consideration, given the fact that the vice president is the next in line to the president, about keeping him off the trail or delaying the vice presidential debate until we see that the president is safe?
Now, listen, we think it's important that our campaign vigorously proceed. And look, the MAGA movement is bigger than just President Trump. He's instrumental, of course, but he is not the only key element of the MAGA movement. And so what we have said is that the other people, including, of course, Vice President Trump, campaign people, millions of regular Americans, need to step up and to some degree fill the void that is left, because our champion, our main instrument, is not able at this moment to vigorously campaign, and certainly not campaign physically right now at all. But in terms of continuity of government, the government is functioning flawlessly right now. It will continue to. The United States, thankfully, has vigorous structures for chain of command, and there will be no disruptions there.
And the vice president is going to go on with his schedule as planned, to the debate, to rallies.
Correct. He is going to continue to campaign, of course, with an abundance of caution. That was already in place, but even more so now.
And I guess part of the question is, what is the likelihood, being where he is right now, that he can participate in a presidential debate in 11 days?
So it is always very difficult to make judgments about individuals, especially unless you're really involved in the care. Overall, in this age category, people of the president's age, there was a large study done by CDC in January to May timeframe that said that about a third of people his age who were diagnosed with COVID would be hospitalized, and that there is a significant mortality rate in that age group. Now, the president is receiving extraordinary care and looks like he's doing well, but it's certainly a serious disease for people of his age and with underlying condition. We do know that some people have symptoms that are mild and recover and do extraordinarily well in the first week, but there are others that in the 5 to 10 day time range can have a relatively quick deterioration and develop more severe symptoms. And it's very difficult to judge that at this time. Again, those additional test results would help us make some judgment about the likelihood of his disease getting better or the potential for worsening. In terms of the debate, I think it's too soon to say. Oh, go ahead, Chris.
I was going to ask you, though, because this does get to the bigger issue of the proper safety regulations, the rallies that the president held, where thousands of people were there, oftentimes with no separation, the vast majority of them not wearing masks. And then, as I discussed with Steve Cortez, the president's family and advisors ignoring the requirement at the debate that they wear masks.
And I think when the commission sets rules for preventing transmission during debates, they should be followed. People shouldn't be making their own decisions. They should be following the rules that are established by the public health experts who set up those debates.
I want to pick up on a question I asked Mr. Cortez, and that's the continuity of government, because the president is in the hospital, as we say. His prognosis is uncertain. And the course of this, your thoughts about Vice President Pence, the next in line to the presidency, going ahead with public rallies, going ahead with this debate, is that a sensible action for him to take, or does it raise concerns on your part about the next person in line to the presidency?
Well, my view at this point is that the rest of the debates, the vice presidential debate, and if there are presidential debates, should be virtual. I think at this point we've seen from the first debate that there were unanticipated very large risks that developed around the debate and in the days afterwards. And in fact, by public accounts, it looks like the vice president had a meeting with the president on Tuesday, a period of time where he would be presumed to be contagious. And so in my mind, it seems like the vice president should be in quarantine, even if he is getting tested on a daily basis. And so in any event, I don't think it is a proper risk to take to have him gathering with Senator Harris in person, and they could easily do this debate virtually, as was done in the past for, at least in the case of Kennedy and Nixon. If you look at the numbers across the country, and there are places in the country, in the Midwest, and particularly in Wisconsin, which are having extraordinary numbers, their highest numbers yet since this pandemic started, with places in Wisconsin having trouble accommodating all of the sick people that are coming sick with COVID. So I think people need to really continue to take this very seriously, to avoid large gatherings, wear masks, physically distance as they have been over time. And hopefully in the months ahead, we'll begin to get vaccines coming online. But in the meantime, it's important to take all the precautions we've been taking all along to prevent transmission.
Clearly, Democrats, Republicans, and independents want someone that is following the facts and is going to help them out and their families and get us through this pandemic.
Senator, the Biden campaign has taken down all of its negative ads, but the president's, some Republicans are saying that Democrats are still attacking the president while he's now in the hospital. Should discussions about COVID be off limits at this particular point?
Well, not discussions about COVID, not when you had 7 million people get this virus, not when you have people in assisted living who have been isolated for this entire year, and moms juggling their kids on their laps while they're trying to do their work.
The Trump team, including his family at the debate, has been operating in the absence of caution. And I think that will sort of put additional focus on the ways in which the Trump world, the Trump campaign, the White House, the president himself has not taken the kinds of precautions you'd expect him to be setting an example for the rest of the country.
Jillian, I want to pick up on this question of continuity of government, because we've got such dramatically different answers from the Trump campaign advisor, Steve Cortez, and from the public health expert, Dr. Inglesby. With the president in the hospital and, you know, the word coming out that whether it's the next 48 hours are critical or days 7 through 10, we don't know. We hope, but we don't know how the president is going to do here. And I want to ask you what you're hearing from your sources in the national security community. How concerned are they about the vice president's intention, apparently, to go ahead, to go back on the campaign trail, to conduct this debate with Senator Harris, the vice presidential debate in Utah on Wednesday, given the fact that under the lines of presidential succession, he's next in line to be president?
So, Chris, since the president's diagnosis, his positive test result became publicly available a few days ago, I've pretty much spent the entire time speaking to national security officials in this administration, current and former, in previous administrations, and to a person, every single source tells me that the #1 priority now going forward is on what you just mentioned, continuity of government operations. In layman's terms, that essentially means making sure that the government continues to function as normal now while President Trump is in the hospital, and then over the coming days, should he become more ill, more gravely ill than he is now, making sure that there is a plan for that too. They are working on that behind the scenes hour by hour now. The White House isn't talking about this publicly yet, aside from saying everything is fine, but that is going on behind the scenes. There's a lot of machinations and internal calculations about how to prevent more spread inside the White House, moving people to different locations, varying hours of work, who is allowed to go over to Walter Reed and see the president, that kind of a thing.
But Jillian, specifically, is there talk, either among current officials or just in the people in the national security community, that perhaps the vice president should shelter himself, shouldn't be going out in public and rallies and going out to this vice presidential debate?
People in Biden world say that, of course, Vice President Pence should be sheltering in place. He should be quarantining, not only because he was exposed to President Trump, but also because his health is now a matter of national concern. He has a greater obligation to the American people than ever before to keep himself healthy. The Trump team says absolutely not. This week, he's going to be on the campaign trail.
And that's it for today. Have a great week, and we'll see you next Fox News Sunday.